to Dolores Stapleton Harris, and of course the district medical doctor, Dr. Bernicia Nisbet, for participating in this very rich experience for the people of the community of St. Paul's and the adjoining areas. I think this has been highly successful. We had a sense of joy. We at the end of the question and answer period, a number of persons moved forward to have their vaccination. That tells me that it was very persuasive, it was impactful, and it has helped. And I know these persons are going to be ambassadors. They're going to be out there with their own experience, sharing with others, and as a consequence, we're going to have more persons participating in the program.
Yeah, I know we can make it. It's only just a phase. Once we're vaccinated, and everybody gon' be safe. Everybody gon' be safe. One kind, yeah. One people. We are roll up to roll out, yeah. 'Cause no man's alone. Do what's right, alright. 'Cause I love you, brother, my sister.
Is on.
Good day and welcome to another National Emergency Operations Center COVID-19 weekly briefing for Wednesday, the 28th of July, 2021. Thank you very much for joining us for our briefing as we continue to update you with the most up-to-date information with respect to the management of the COVID-19 pandemic here in the Federation of St. Kitts and Nevis. I am Lesroy Williams. Today I would first like to invite to the podium Superintendent Cromwell Henry, who is a member of the National COVID-19 Task Force and who will give his presentation with respect to the COVID-19 regulations.
Thank you very much, Mr. Williams, and a pleasant good afternoon to all listening to this broadcast via whatever means. We continue to see an easing of restrictions in this new iteration of the Emergency Powers COVID-19 regulations, SRNO 31 of 2001. While most of the provisions of this new regulation remain the same as previous versions, this latest version, which commenced on July 26, has allowed for more time before the night curfew begins. The night curfew now begins at 11 p.m. nightly and ends at 5 a.m. the following day, and this will continue until August 9th. The restrictions on social activities remain in place, and they continue to require permission from the Commissioner of Police. Mass gatherings are still prohibited, and only limited social activities are being approved at this time. We are reminded that we are not yet out of the woods, as we are still seeing new cases daily, which indicate the virus is still in the community. As such, we encourage all to get vaccinated to reduce your risks and to follow all the non-pharmaceutical measures to further protect yourself. Regulation 14 of the new regulations provides some restrictions on travelers entering the Federation. Subregulation 5 states, all arriving travelers who are fully vaccinated against the COVID-19 virus shall remain in a government quarantine facility for a period of 3 days and be tested for the COVID-19 virus on day 4. Subregulation 5C continues, the person shall only be released from quarantine upon receiving a negative PCR test. On Wednesday, 21st July, Farrakhan Asagai and Natasha Robinson arrived in the Federation from the USA and were in quarantine at the Mount Pelier Hotel in Nevis. On the morning of Saturday, 24th July, the couple left their quarantine without authorization and journeyed to St. Kitts via a ferry. They were eventually located at a residence in Frigate Bay that night and were taken to the government quarantine facility at the OTI to complete their quarantine and to be tested. Their test results returned negative, and they were released from quarantine on Tuesday, 27 July. They were taken back to Nevis, where they were arrested and charged for breaching their quarantine. And they were taken before the Charlestown Magistrate Court, where they were convicted and fined US $500 to be paid in 1 day. The fines were paid, and they were allowed to leave the Federation. The police have taken a zero-tolerance approach to breaches of quarantine, as this puts the entire community at risk. This includes persons who are required to remain in self-quarantine at their homes on the instruction of any medical officer. Again, we continue to solicit the full cooperation of all residents to adhere to all the COVID-19 protocols, whatever instructions or directives are imposed by any medical officer, as these are all intended to keep us all safe. As we approach the long holiday weekend, we are reminded again that social activities are restricted only with the permission of the Commissioner of Police should such activity take place, and we ask persons to exercise extreme care and caution not to put yourself at any risk of being infected with COVID-19. Avoid crowds, avoid crowded events, and always wear your mask and follow all the other protocols. Thank you.
Thank you, Superintendent Henry. I now invite our Chief Medical Officer, Dr. Marissa Carty, the Public Relations Officer at the Health Emergency Operating Center, would give the situation report for today. Dr. Carty.
Thank you, Mr. Williams, and a pleasant good evening to all listening. This evening, I present the Health Emergency Operating Committee's situation report for Wednesday, July 28th, 2021. The response to the COVID-19 pandemic continues to be robust here in the Federation of St. Kitts and Nevis. During the period May 19th to July 27th, we have seen an increase of 537 confirmed cases, of which 492 persons have recovered. There are currently 42 active cases, with 2 hospitalizations and 3 COVID-19 related deaths. The graphs shown indicate that we saw our highest number of cases in this current wave during the period June 6th to June 24th. Additionally, owing to the work of the contact tracing team, we are now seeing a flattening of this curve. Therefore, to summarize our current situation, the Federation has a total of 582 confirmed cases of COVID-19, with 562 cases in St. Kitts and 20 cases in Nevis. 537 cases have fully recovered, and we now have 42 active cases, 2 hospitalizations, and 3 COVID-19 related deaths. We continue to monitor the situation in the prison. To date, a total of 56 inmates have been impacted, of which 55 have fully recovered, leaving only 1 active case in the inmate population. The prison staff has also been affected, with 18 confirmed cases, 14 of whom have since recovered. There are 4 active cases among the prison staff. In response to the outbreak in the prison, a training session was held on July 9th to build the COVID-19 response capacity in the prison system. Our contact tracing efforts continue. 2,701 persons have been interviewed and placed in self-quarantine. 2,539 persons have since been released from quarantine, while 162 persons remain in quarantine. During the period May 19th to present, approximately 15,668 samples have been processed here in the Federation. Our vaccine program continues, and by the end of day, Tuesday, July 27th, 71.8% of the target population had received their first dose, and 59.4% of the target population had received their second dose. Persons who would have received their first dose of the vaccine between June 3rd and 30th would have received a 12-week appointment. Since the recommended interval between doses is 1 month, 4 weeks, to 12 weeks, persons can return for their second dose once 4 weeks or more have elapsed since receiving their first dose. Please note that the current batch of vaccines will expire on August 30th. Additionally, based on the calculations, we have at least 9,320 adults left to be vaccinated to achieve our target population. New health and travel policies came into effect on June 12, 2021. Inbound passengers will now qualify for a reduced quarantine period of 3 days, with the exit test sample taken on day 4. Once a negative RT-PCR result is received from the laboratory, the traveler will be released from quarantine. And important to note, if day 4 falls on a Sunday, the sample will not be processed until Monday. The RT-PCR test results can be expected within 12 to 48 hours. For persons leaving quarantine, The certificate of release from quarantine isolation will be issued by the Chief Medical Officer. This certificate can then be attached to the Social Security sick leave form and submitted. Please note that Section A of the Social Security form must be completed by the insured or the employee, while Section C must be completed by the employer. The CMO's letter will suffice for Section B of the form. Living with COVID-19 requires adherence to the COVID-19 protective measures and behaviors, which includes wearing a face mask appropriately covering both the nose and mouth, sanitizing your hands with soap and water or an alcohol-based sanitizer, maintaining a safe distance of 6 feet or more from persons with whom you interact, or staying at home when ill or when ordered to do so. Another important measure against this virus is to be vaccinated. Finally, our 311 operators have been responding to a number of calls, and we just want to take this opportunity to share with you their responsibilities. Number one, to assist persons who are experiencing respiratory tract symptoms, to address callers with issues to individuals within quarantine or isolation, to address any questions related to general health systems operations, to document the side effects of the vaccine, to refer callers to psychosocial needs and concerns. And please note that our 311 operators do not provide COVID-19 test results. Additionally, they link callers to allied support officials, including our police, our contact tracing team, and even our social services. And finally, they do document the requests for letters for persons who will be leaving quarantine or isolation. Let us all work together to reduce the impact of this disease. Stay safe, stay healthy. I thank you.
Thank you, Dr. Carty, for presenting the NEOC situation report for today. That brings us to our question and answer segment for today. The first question: why is a certain doctor using rapid tests which are known to give faulty readings and false negatives for patients who have COVID-19 symptoms? This is causing patients to have a false sense of security and go untreated, thus further compromising their health while causing the virus to continue to spread in our community. Can something be done to stop this practice and to mandate that RT-PCR tests are the only tests that should be used to diagnose persons with COVID-19 symptoms?
Well, first let me say that I'm not aware of that practice, but it's a serious allegation and one that would have to be looked into. I believe, though, that every physician in the Federation of St. Kitts and Nevis know that the test that is recommended by the Ministry of Health is the gold standard PCR test. It has been our policy to only use this test when we are testing persons for the virus. And one of the reasons why we do not use the rapid antigen test, or it's not being used as yet, the sensitivity of those tests can vary anywhere from 50.6 to 84%, which means that if this test was being used to identify persons, you could have 46% of persons being told that they have a negative test when in fact they are actually positive for the virus. And of course, it can give them a false sense of security. They can go out thinking that they were normal and continue to spread the virus to other persons, leading to a significant increase in the positivity rate and the R number, leading to a second or third wave of the virus. And so I do hope that the allegations, they are not so, but any physician who is listening to me, if they are using the rapid antigen test, they need to desist immediately, because that would only jeopardize the health of the persons who you're looking after. And one of the first things we learn in medicine is first do no harm.
Thank you, Dr. Wilkinson. The second question. In Israel, persons are criminally charged if they know they are COVID positive and breach isolation. Why are we not criminally charging persons for breaching isolation when they know they are COVID positive? Persons that do this should be charged with attempted murder, at the least a murder, if any of their contacts die. Can this be done here, as it has become evident that there are persons in our society who have no regard for the health and the safety of others? Superintendent.
Thank you, Mr. Williams. As I indicated, the police have now adopted a zero tolerance for persons who breach both isolation and quarantine. We have announced some criminal charges that were brought against persons who have breached their quarantine in the past. During the lockdown period, we've had some persons who would have breached their isolation, and as I indicated, a criminal investigation has been launched. In fact, the Criminal Investigation Department has a full-scale investigation ongoing into the activities of those persons, and I'm certain that we will be announcing the result of those investigations in due course. So yes, persons who breach their isolation and their quarantine, they will be investigated, and appropriate criminal charges will be brought against them. I don't think it goes as far as murder or attempted murder, but there are offenses created under the Quarantine Act to deal with persons who breach that act.
I don't think the person meant murder literally, but I think they were more or less speaking figuratively to show how serious the matter actually is. This question is from SKN Vibes. Can we get an update on the country status with the Gavi Alliance and its impact on COVID supplies, COVAX arrangement, and the current status of deliveries given uneven global access to vaccines? Chief Medical Officer.
We have already received our first tranche of vaccine doses through the COVAX facility, and we are in constant contact with the leadership of the COVAX facility in terms of when next we are to expect vaccine doses. And so as soon as our next batch of vaccines through that facility is expected, we will communicate that to the public.
This next question, I would like to know if I can take the vaccine because I recovered from the virus the ending of June. I was told that I cannot take my second dose of vaccine because I have natural immunity. I would like to know how long I would have to wait before I can take it. So this is a person who would have recovered and
once you have recovered from COVID-19, you will have some degree of natural immunity, which we've said on this podium, wanes over about 90 days. However, you can have your second dose anytime after you've recovered. So to that person, you can have it tomorrow, you can have it the day after. The thing is, in a situation where vaccines are scarce, persons who have recovered in those countries, they allow them to wait while other persons who have no immunity at all step forward to get vaccinated. But here in St. Kitts, where we don't have a long waiting line for persons to be vaccinated, you can go forward and get vaccinated. And I just want to add something to what the CMO said in relation to the question that was asked about the COVAX facility. We have to understand that through COVAX, the plan is to make sure that everyone on the face of the globe has access to the vaccines, because the policy is that no one is safe until everyone is safe. And they're hoping that by the end of September, 10% of each population around the globe would have had vaccines. We are already way ahead of the game in terms of the number of persons who are vaccinated here. And so I would not be surprised if we do not get our second tranche right now, because no one is safe unless everyone is safe, and the COVAX facility is making sure that the vaccines are available globally to everyone across the globe.
this next question, if possible, can you please clarify the entry quarantine period for fully vaccinated persons?
If you are an inbound passenger and you are fully vaccinated, you will qualify for a reduced quarantine period of 4 days, whereby you will be in quarantine for 4 days. Your exit test sample will be taken on the morning of the 4th day. So on day 4 of your quarantine, your exit test sample will be taken, and then once the result is returned at the end of the day negative, you can then be officially released from quarantine. So the quarantine period technically is 4 days.
Thank you for that clarification, Dr. Laws. These next two questions. In light of the fact that the Pfizer vaccine has been approved for children under 18, will St. Kitts and Nevis be receiving or seeking to obtain Pfizer vaccines within the next few months? And the second question, there have been indications that another variant of the virus may be in circulation. Has it been confirmed whether the Delta or any other variant is in the Federation?
First, let me correct something that was incorrect in the question. The Pfizer is for persons between the age of 12 to 18. That is the under 18, 12 to 18, and not just under 18. And yes, we have said before that we are seeking to get other vaccines, and I do hope that sometime soon we would get some Pfizer vaccines so that we can have our 12 to 18-year-olds immunized, and that would help to boost our population immunity and allow us to absorb more risk. In terms of the variant, we have sent off other samples to CAFA for testing. for genomic sequencing. And so when we get those results back, we'll see whether or not we have any other variants here in the population circulating.
Thank you, Dr. Wilkinson. That brings us to the end of our question and answers for today. Thank you for sending your questions, and I do hope that they were answered to your satisfaction. The NEOC would like to acknowledge a Mr. Rudolph Keynes of Sadlers, who donated $2,000 towards the national fight against COVID-19 in St. Kitts and Nevis. The donation was made to the Permanent Secretary in the Ministry of Social Development, Mrs. Janelle Lewis Tafari. So thank you very much, Mr. Keynes. Your donation is appreciated. I want to thank all the presenters for today. I thank Dr. Marissa Carty for presenting the Health Emergency Operating Center Situation Report, Superintendent Cromwell Henry for his presentation on the new regulations. I additionally want to thank Minister Wendy Phipps for her continued support, the Honorable Wendy Phipps, here at these NEOC briefings. She is always here, and she is the chair of the she is the co-chair of the Disaster Mitigation Council. I want to thank the media. We thank ZIZ, and I continue to thank the media for partnering with us in this COVID-19 fight, the management of the COVID-19 pandemic. We hear that in the US now there's a lot of vaccine hesitancy, and we are having this, people are coming out and saying that there's still a lot of misinformation and disinformation around that is preventing people from going forward and getting vaccinated. So we encourage you to go to official sources and to get information with respect to the pandemic and with respect to the vaccines. Here alone in St. Kitts, we have had thousands of persons who would have taken the vaccine, and so the data is there in the Federation that the vaccines have really not caused any deaths or any real serious adverse reactions of people. So we know that from the data that we have had here in the Federation, I'm not a medical doctor, but a little common sense, that the vaccines are safe and that they are effective. Thank you to all of you for coming out today here at the NEOC, and thank you to all of you for joining us for our briefing for today. Next week we will be back. Did I thank Dr. Cameron Wilkinson? I don't think so. Dr. Wilkinson, thank you very much. You make these briefings, you come up and you always answer the questions, and that is really to be admired because people have questions that need to be answered. So thank you very much. Thank you to all of you. Next week, we'll be back with another NEOC briefing. Until then, take care. I am Les Roy Williams.
It's only just a phase. Once we're vaccinated, and everybody gonna be safe. Everybody gonna be safe. One kind, yeah. One people. We are roll up to roll up, yeah. 'Cause no man's alone. Do what's right, alright. 'Cause I love you, brother and sister. And we're in this to my radar. I don't wanna lose you. I love you too much. I think it's better for us, yeah, yeah. It's better for us, yeah. I don't wanna lose you. I love you too much, yeah, yeah. It's better for us. Tell your mommy to let it roll out.
Bless up, Dejo here, and I'm doing my part in the fight against COVID-19 by following all safety protocols and, most importantly, rolling up my sleeve for the vaccine. So I'm encouraging you to do the same, because that's our best shot of protecting ourselves, our family, and our friends. So don't wait, vaccinate. Let's roll up to roll out.
I'm here to say kids, Nevis. You don't know informers I represent for the Ministry of Health. Yeah. Respect the COVID protocols. In a time like this, all for one for all. St. Kitts Nevis. Don't forget your mask. Wear it everywhere you go. Sanitize before and after everything you do. Cause you never know what's on the surface of the places you go. Maintain a safe social distance between me and you. Keep calm and stay focused. Don't be a fool, seek the facts first. And boost your immune system up. Don't wanna lose no more of us. Mask up, sanitize, observe the protocols all about. Be wise. Mask up, sanitize. Me family fitting boat. And you.
Blessed love and greetings. This is Infamous, and I am here to encourage every Kittitian and Nivision to remember that we have our part to play in the fight against COVID-19. So sanitize, wear your face mask, practice social distancing, and go and get vaccinated. For me no know about you, but me love think it's bad. Easy no man.